Well, good morning, and can I start by offering my deepest condolences to the families that lost loved ones overnight, and you remain in our thoughts and prayers. Again, up to 8 p.m. last night, which is the recording period, we have grave concern about the far west and the western part of New South Wales. Western New South Wales Local Health District, there were 38 cases reported to 8 p.m. last night. There were 32 in Dubbo, 2 in Bathurst. Since this morning, since the reporting period of 8 p.m, we've been advised this morning there's a further case in Bathurst, and there'll be more said later this morning. There are 2 in Wellington, 1 in Walgett and 1 in Narromine. In the far west local health district, 14 cases, 12 in Wilcannia and 2 in Broken Hill that we mentioned yesterday. Those cases in Wilcannia continue to concern us. We know there was an event in a gathering in Wilcannia, and we know that people travel from all over regional and rural New South Wales to Wilcannia and now have returned home. So for anyone that lives in Wilcannia, the message is get tested regardless of symptoms. Come forward. We need to get on top of it. This is of concern not only to the far west, but to the rest of regional and rural New South Wales. The Central Coast had one more case, but that was one that was of a close contact. Now, there's a good example with the Hunter, New England. There was one case in Newcastle. This particular person was in isolation throughout the whole infectious period. Going back a few weeks ago, we had days in Newcastle that we were reporting over 20 cases a day or 10 cases a day. And it clearly shows that the lockdown and the restrictions put in place in the regions and the extension of those lockdowns has actually protected that community, more importantly, lowered case numbers. So it's a great example of the local health district, the team on the ground, but also the community doing the right thing. And my message to everybody in regional rural New South Wales, the reason for the lockdown, the reason for the restrictions, you may not have a case today, is to make sure that you never get a case in the future. And that's why the restrictions play an important part. Southern New South Wales, there were 2 cases in Goulburn, but they were also reported yesterday. And in Illawarra, Shoalhaven, overnight, 1 case in Kiama, which was, of course, a close contact. We have concerns to our sewage detection, which hasn't let us down to this point. It has been an important tool in identifying areas of concern, and our focus now is in Orange and Lithgow. And again, the message for anyone in Orange and Lithgow, if you're not feeling well, if you don't feel right, please come out and get tested. We need to get ahead of the curve in our regional and rural areas. We've heard already this morning in Victoria, numbers are up, but alarmingly, numbers in regional Victoria are of concern, and that does threaten the New South Wales-Victoria border. And to those communities on the border, please be vigilant, get tested, minimise travel, follow the restrictions, follow the stay-home orders. It is about protecting you and your communities and your loved ones. Again, the message to everybody in regional rural New South Wales is to get vaccinated. Get online, book, so that we can continue to raise our vaccination numbers, not just here in Sydney, but right across regional New South Wales, and help us stop the spread.